Hello, my name is Barbara Munoz. I'm the Associate Director with the Utah Academy of Family Physicians, and we are very happy to be joined by Danielle Conlon. She is the Outreach Specialist for the Department of Health and Human Services Center for Medical Cannabis, and she is going to take us through the laws and operations basics today. So we'll go ahead and just let her get started. Welcome, Danielle.
Excellent. Thank you so much. As Barb mentioned, my name is Danielle Conlon. I am an outreach specialist for the DHHS Center for Medical Cannabis. And I'm very excited to be here today and to present and provide more information about Utah's medical cannabis program, and particularly the laws behind Utah's medical cannabis program and some of the basic operations and how to participate in the program. As a disclaimer, this presentation highlights parts of Utah medical cannabis laws and provides information that is current as of the date of this presentation. But while it outlines some Utah laws, it isn't meant to be comprehensive. If you are interested in reviewing the complete set of laws for the Utah Medical Cannabis Act and other laws regarding medical cannabis in Utah, they are available on the Utah Legislature's website. The link is right there on the slide. And then this presentation is intended for general information purposes only and is not intended to be, nor should it be used as legal advice. So first, I wanted to go through the objectives for this presentation. First, attendees will be able to state at least one difference between the QMP program and the LMP program. Second, attendees will be able to state at least 3 qualifying medical conditions for cannabis use in Utah. Third, attendees will be able to list at least 3 types of legal medicinal dosage forms of cannabis in Utah. And fourth, attendees will be able to understand the specifications and protections for providers who recommend medical cannabis as outlined in the Utah Medical Cannabis Act. And I also wanted to start with providing the DHHS Center for Medical Cannabis mission statement. And this mission statement is really what pushes us forward in how we administer the program and changes that are made to the program. So the Center for Medical Cannabis ensures that qualifying patients are guided by trained medical professionals to receive access to safe and effective cannabis products. And that directly relates to our providers. We want to make sure that providers understand the program, they feel confident in how to participate in the program if they have patients that would benefit from medical cannabis, and that they have resources to confidently recommend medical cannabis using evidence-based practice. There are 3 primary governing bodies within Utah's medical cannabis program. They are the Department of Health and Human Services, also known as DHHS, the Utah Department of Agriculture and Food, also known as UDAF, and then the Utah Legislature. So I'll go through each governing body and their roles in administering the program. To start with DHHS, DHHS oversees a lot of the public health and patient-facing aspects of the program. So this is going to include medical cannabis card regulation, such as patients applying for and receiving medical cannabis cards, as well as recommending medical provider regulations. So reviewing all medical provider medical cannabis recommendations, as well as for medical providers that must complete registration and continuing education requirements, ensuring that those are met. DHHS also oversees a couple of boards. The first is the Compassionate Use Board, also known as the CUB, which we will talk about in more detail a little bit later in the presentation. And the Compassionate Use Board reviews petitions that medical providers make for patients who do not meet the legal requirements in the Utah Medical Cannabis Act to utilize medical cannabis, but would still benefit from medical cannabis use. And so for these petitions, the CUB will review them, determine if, although the patient doesn't meet the current requirements in law, if they should still be issued a medical cannabis card. DHHS also oversees the Cannabis Research Review Board, also known as the CRRB. And again, we'll talk a little bit more about this in more detail later in the presentation. But the CRRB is a board of medical professionals, clinicians, researchers, academics, who review all of the research regarding medical cannabis and publish recommendations and best practice guidelines for providers who are recommending medical cannabis. DHHS also oversees medical cannabis software that we're using in Utah. This includes our electronic verification system, also known as EVS. And EVS is the software system that really any patient-facing entity, such as a provider, a medical cannabis pharmacy, the patient themselves, is going to utilize in order to provide medical cannabis recommendations, to track what the patient has purchased, etc. And then there's also the inventory control system software, also known as ICS. And this software tracks all of the medical cannabis inventory in Utah from the time it is grown in a cultivator to when it is processed, provided to a pharmacy, and then sold to the patient. DHHS also oversees administrative rules. So in addition to the Utah Medical Cannabis Act, that is updated by the legislature in legislative sessions, DHHS has the ability to write administrative rules to further provide regulations to the program. DHHS also provides medical cannabis public awareness and education. This is for everyone. So we provide education for patients who are interested in learning about medical cannabis. We encourage safe and responsible use of medical cannabis in our education. And we also provide education to medical providers who are interested in participating in Utah's medical cannabis program, who want to learn more, who need to know more specifics about the law, etc. We also oversee medical cannabis pharmacy regulation. This includes the medical cannabis pharmacies themselves, as well as medical cannabis pharmacy employee and medical cannabis pharmacy courier regulation. So for the brick and mortar pharmacies themselves, we do inspections. We ensure that they're following all laws and regulations to sell medical cannabis to patients. We also ensure that all pharmacy employees are following rules and regulations, including that they've had the proper background checks before working in the cannabis pharmacy. And many of our medical cannabis pharmacies also offer home delivery and courier services. And so in those cases, we ensure that the medical cannabis that is being transported throughout the state is following all rules and regulations. The couriers are following laws, rules, and regulations, etc. Next, we'll talk about UDAF. So UDAF really oversees cultivation and processing of medical cannabis. And so for both cultivators and processors, they will ensure that all rules, laws, and regulations are followed. Our cultivators are the organizations who are growing medical cannabis, and the processors are the organizations that are making or processing it into medical cannabis products like a tablet, a cream, a vape cartridge, etc. UDAF also oversees the independent testing lab regulation. Utah has very stringent testing laws for medical cannabis. We work hard to ensure that all medical cannabis in our medical cannabis pharmacies is safe and that there aren't any contaminants, pesticides. We test for other cannabinoids to ensure that we know what's in the product, and then that patients can know what's in the product as well. They also oversee the Cannabis Production Establishment Licensing Board, and this board is utilized to license cultivation and processing facilities. UDAF oversees the hemp program regulation. And so medical cannabis and hemp are a little bit different. Medical cannabis is what is provided to patients. It is what is sold in a medical cannabis pharmacy, while hemp can be sold outside of a medical cannabis pharmacy if it has less than 0.3% of THC. That's why you may see like CBD products that are available to be sold in a grocery store. Because they are low in THC, they are considered a hemp product and not a medical cannabis product. But UDAF oversees both medical cannabis and hemp. And then just like DHHS, UDAF also has the ability to write administrative rules in addition to their laws passed by the legislature in order to provide more needed rules and regulations to the program. And then finally, the legislature oversees and writes medical cannabis law and statutes, such as the Medical Cannabis Act. Now we'll talk about our recommending medical providers. Throughout the presentation, I may refer to these as RMPs, and RMPs include all of our medical providers, so QMPs and primarily LMPs, but sometimes our PMPs as well. So there are 3 recommending medical providers that we see within Utah's medical cannabis program. We'll talk about all of them in detail throughout this presentation. First, there is qualified medical providers, also known as QMPs. There are limited medical providers, also known as LMPs, and there are pharmacy medical providers, also known as PMPs. And now where we're getting into more of the specifics of Utah's medical cannabis program, there will be situations where a lot of parts of the program dovetail. So we'll be talking about providers, we'll be talking about qualifying conditions, the different boards, and we will discuss all of those in detail throughout the presentation. But I may touch on some aspects of the program that we haven't discussed in detail quite yet. First, we'll talk about our qualifying medical providers, or our QMPs. In order for a medical provider to be a QMP, they must be a Utah licensed MD, DO, PA, APRN, or DPM. They also must have a current controlled substance license, and they must complete at least 4 hours of DHHS approved education during each 2-year renewal cycle, register as a QMP within the EVS, and then also pay a $100 registration fee. Once a provider is registered as a QMP, they have a limit of 275 active medical cannabis patients at a time. However, in some situations, that limit can be increased to 600 active medical cannabis patients if the QMP is board certified and licensed in one of the following specialties: anesthesiology, gastroenterology, neurology, oncology, pain management, hospice and palliative medicine, physical medicine and rehabilitation, rheumatology, or psychiatry. Additionally, QMPs can provide medical cannabis recommendations to patients who are younger than 21 years, and they are the medical provider who can petition the Compassionate Use Board. When a QMP recommends medical cannabis to a patient, this is a general outline of what that will look like. So first, the QMP must have an initial face-to-face appointment with the patient. It has to be in person. Telehealth does not qualify for these initial visits. They must make the recommendation in the setting of a provider and patient relationship, and they must conduct a thorough medical assessment. In this medical assessment, they need to review the patient's form of identification, check for any contraindications to medical cannabis in the controlled substance database, consider the patient's qualifying condition that they would use medical cannabis for, and then consider the patient's history of substance use or opioid use disorder and the patient's history of medical cannabis and controlled substance use. After this assessment has been completed, the QMP needs to document the assessment in the patient's record, and then they have the option of documenting any necessary information in the medical cannabis recommendation in EVS. It is important to note that any information in EVS can be seen by other medical providers who look at the patient's medical cannabis recommendation. So this would include a pharmacy medical provider when the patient is purchasing cannabis in the medical cannabis pharmacy. The pharmacist can look in EVS and see any information submitted by the provider. Additionally, any future medical providers that the patient goes to for medical cannabis recommendations will be able to see what is entered into EVS as well. And so that's important to note, just as we really try to provide comprehensive care to patients and encourage that among medical providers. And so any information that would benefit the patient and other medical providers that help this patient, we would recommend that providers enter that into EVS. And then once in EVS, the QMP can finish submitting the medical cannabis recommendation for the patient. So since QMPs are the only medical provider that can petition the Compassionate Use Board, I wanted to provide some more information about it. So as I mentioned briefly before, the Compassionate Use Board reviews petitions for medical cannabis recommendations for patients who don't otherwise meet the requirements for medical cannabis in Utah. These include patients who are younger than age 21, and patients who don't have a qualifying condition for medical cannabis as listed on Utah's qualifying conditions list, but the patient does have an intractable condition that is substantially impairing their quality of life, and they haven't responded to any conventional treatments. So the QMP is going to fill out the petition. There is a petition form on our website. They'll submit it to our Compassionate Use Board. And then monthly, the Compassionate Use Board meets. They review all of the petitions, review all of the patient's medical history, information about the patient's condition, etc., provided by the QMP. And then they decide whether or not medical cannabis would benefit the patient and decide whether or not to provide a medical cannabis card. Next, we'll talk about our limited medical providers, who are LMPs. In order to participate as an LMP, a provider must be a Utah licensed MD, DO, PA, APRN, or DPM. They must have a current controlled substance license. However, LMPs do not require any continuing education or registration with DHHS. Because LMPs don't require any registration or continuing education, they can only treat their own patients. So really the LMP program, when it was implemented, it was really intended as an LMP is like a primary care provider who is seeing patients. They'll generally see patients for extended amounts of time, like months or years, and they can still provide medical cannabis to patients who would benefit without needing to refer to a QMP, but they aren't specializing in providing medical cannabis per se. Additionally, LMPs can only see 15 active medical cannabis patients at a time. They cannot provide any recommendations to patients who are younger than 21 years, and they cannot petition the CUB if a patient doesn't have a qualifying medical condition to use medical cannabis. If they had a patient without a qualifying medical condition or who is younger than 21 years, they would need to refer that patient to a QMP so that the QMP could petition the CUB. When an LMP recommends medical cannabis, similarly to the QMP, they're first going to have an initial face-to-face appointment with the patient, and they'll make the recommendation in the setting of a provider-patient relationship. They'll conduct a thorough medical assessment that includes reviewing the patient's form of identification, checking for any contraindications to medical cannabis in the controlled substance database, and considering the patient's qualifying condition, their history of substance use or opioid use disorder, and their history of medical cannabis and controlled substance use. They need to document this assessment in the patient's record, and then they will go on to the DHHS Center for Medical Cannabis website and download the limited medical provider recommendation for medical cannabis form. They'll complete this form, and then they'll submit the form to a licensed medical cannabis pharmacy. They would need to contact the medical cannabis pharmacy to determine the best way to submit this. Medical cannabis pharmacies may accept them via encrypted email, via fax, via being delivered by a patient, etc. These screenshots show what the limited medical provider recommendation form for medical cannabis looks like. So we'll just go through the different parts of it. One important thing to note is that there is additional information on this form that I didn't include on these slides. There are appendices with information about dosage forms, dosage amounts, and Utah's list of qualifying conditions. And so that is something to go onto the website, download the form, and then review that information. But in general, when submitting this form, the LMP will need to provide information about themselves and their practice. This is going to include their name, their DOPL license type, their professional license number, DEA number, controlled substance number, and NPI number. And then information about the clinic or practice where they work, including the name, email address, mailing address, and telephone number. They'll provide information about the patient, including the patient's name, their qualifying condition. And for a couple of qualifying conditions, there is additional qualifying information that needs to be met. We'll talk about those a little bit more in depth when we discuss the qualifying conditions. They also need to include the patient's age, date of birth, telephone number. And then if the patient has had a medical cannabis card for over a year, the LMP can state whether or not they approve the patient having a renewal period for their next medical cannabis card of a year. And then the LMP can decide whether or not to provide dosing directions on this form directly, or to defer those to the medical cannabis pharmacist. So this second page, this has the information about dosing guidelines. And so if an LMP would like to provide dosing guidelines, they can consider both the dosage form and the dosage amount. So they can choose which dosage forms the patient can purchase. They can mark that all forms are allowed, all forms except for maybe some specific ones, or they can go through and mark the specific forms that they would like the patient to purchase. Regarding the dosage quantity, they can mark up to the state limit, or they can restrict the quantity to a smaller amount for the patient to purchase each month. And then the final section of this form is that the LMP can provide any relevant medical or medication history for pharmacy reference. And this is very similar to what the QMP is providing in their medical cannabis recommendation in EVS. So any information that the LMP thinks would be beneficial for the medical cannabis pharmacist to know, and other medical providers who will see this patient's medical cannabis recommendation in the future, they can put that information in the box. And then once this form has been received by the medical cannabis pharmacy, the medical cannabis pharmacist will review this information and submit it into EVS, and then the patient can receive a medical cannabis card. If you are interested in learning more about our LMP program, there was an article that was published in the most recent issue of the Utah Medical Association's Utah's Physician Journal. It includes more information about the LMP program and resources for participating in the LMP program, as well as additional information that providers may be interested in. It is available at this link, and it starts on page 18 if you're interested. Okay, the last medical provider type that we'll discuss are pharmacy medical providers, or PMPs. And PMPs are very similar to QMPs. They need to be a Utah licensed physician or pharmacist. Currently, all of our PMPs are pharmacists, but the law also allows for physicians to fill this role. They need to complete at least 4 hours of DHHS approved education during each 2-year renewal cycle, register with the EVS, and pay a $100 registration fee. And PMPs have very specific roles in working with patients. So first, they must be in the pharmacy during operating hours every day. And that is because they review medical cannabis orders and EVS for patients. They also provide dosing guidelines for patients as needed if the QMP or the LMP refers the patient to the pharmacist for dosing. And then they are required to consult with every patient during the patient's first medical cannabis purchase. And they also consult with patients as needed. So a patient could come in, they've purchased medical cannabis for several months, they have a question for the PMP. The PMP would be available to sit down with them, talk about their concerns, and provide medical cannabis guidance. And then they are also required to review every medical cannabis transaction that happens each day in the pharmacy. We've talked a little bit about the controlled substance database and that providers should be checking the controlled substance database when recommending medical cannabis to ensure that there aren't any contraindications. And so in the controlled substance database, any patient with an active medical cannabis card that will show in their controlled substance database record. So this is available to licensed practitioners with a controlled substance license. And you can see right here in the patient's record under patient warnings, if there is the green leaf, that means that the patient has an active medical cannabis card. If that is clicked on, the provider can see more information about the patient's medical cannabis recommendation and their medical cannabis card. And one question that we receive a lot from medical providers are about legal protections. There are concerns about recommending medical cannabis, even though it is still federally illegal. And so to provide some information about that, in the Utah Medical Cannabis Act, it does state that proper licensure and adherence to state laws and regulations prevent civil or criminal liability and licensure sanctions in regards to medical cannabis in the state of Utah. It is important to note that these are only applicable for recommending medical cannabis. So if other laws and regulations weren't followed for another aspect of a medical practice, but they were followed for recommending medical cannabis, there could be other liabilities and sanctions for the aspects of the practice that weren't being followed. But for medical cannabis, there wouldn't be any liabilities or licensure sanction concerns. Additionally, if laws and regulations are not followed, RMPs may be subject to denial of an application of a medical cannabis card or a QMP registration card, a suspension or revocation of a medical cannabis card or a QMP registration card, or a penalty or fine. Another thing to consider is that these protections are only applicable within the state of Utah, and they do not apply federally. And so if a provider is in a practice where they aren't sure if the practice is receiving federal funding or recommending medical cannabis would be a concern, we would recommend that they talk to their medical director, any executives, and any insurance providers to determine if federal funding and recommending medical cannabis would provide any concerns. Now we're going to talk about Utah's qualifying conditions list. So there are 16 qualifying conditions for medical cannabis use in Utah. Any new qualifying conditions are passed by the Utah legislature and then added into the Utah Medical Cannabis Act. And as mentioned previously, patients who do not have a qualifying condition can be petitioned to the CUB by a QMP. And so we're going to go through just the list of qualifying conditions. So they include HIV or AIDS, acute pain that lasts 2 weeks or longer for an acute condition, such as a surgical procedure, Alzheimer's disease, amyotrophic lateral sclerosis, cancer, cachexia, Crohn's disease or ulcerative colitis, epilepsy or debilitating seizures, multiple sclerosis or persistent and debilitating muscle spasms, autism, but it is important to note that medical cannabis has not been shown to treat autism itself, but it can provide relief for some of the accompanying symptoms of autism. A terminal illness with a life expectancy of less than 6 months. And in the case of a terminal illness, the medical cannabis card would only be provided for a 6-month period, since the qualifying condition does specify that the life expectancy for the illness must be less than 6 months. A condition resulting in hospice care. Persistent nausea that's not responsive to traditional treatment, but it cannot be related to pregnancy, cannabis-induced cyclic vomiting syndrome, or cannabinoid hyperemesis syndrome. Post-traumatic stress disorder. And it is important to note that post-traumatic stress disorder is a condition where additional qualifiers must be met before medical cannabis can be provided for it. And so this is one of the conditions on the LMP medical cannabis recommendation form, where the provider needs to certify that they have verified these other conditions. So the additional qualifiers for PTSD include that it must be being treated and monitored by a licensed health therapist. It must have been diagnosed by a healthcare provider at the VA or by a psychiatrist, a master's level prepared psychologist, a master's level prepared licensed clinical social worker, or a psychiatric APRN, and it needs to be documented in the patient's record. A rare condition or disease that affects less than 200,000 individuals in the US and is not adequately managed by conventional medications besides opioids or opiates or physical interventions. And rare conditions are another condition where there is an additional qualifier that needs to be met before medical cannabis can be recommended. In this case, the provider would need to verify that the condition is considered rare per the NIH website. And the final qualifying condition for medical cannabis in Utah is persistent pain lasting longer than 2 weeks that is not adequately managed by conventional medications besides opioids or opiates or by physical interventions. And we talked a little bit about the Cannabis Research Review Board, but to provide more information, they are a board of physicians that include clinicians, academics, researchers that review scientific evidence related to cannabis use with a focus on the medical treatments that respond to cannabis, cannabis dosage amounts and dosage forms, interaction of cannabis with other treatments, and any contraindications, adverse reactions, and potential side effects. They publish their findings, and that includes creating best practice guidelines for recommending medical providers. These best practice guidelines are a great resource. They include just general guidelines for patients who utilize medical cannabis, as well as best practice guidelines that are completely evidence and research-based for each medical condition that is allowed for medical cannabis use in Utah. This includes things to look out for when utilizing medical cannabis to treat that condition, dosing guidelines, etc. And all information about the CRRB is available on the DHHS Center for Medical Cannabis website. In addition to these best practice guidelines, they have additional resources such as other research that's been reviewed. And if you'd like to watch any of their meetings, they're all recorded. And if you would like to join any of their meetings, they are public meetings, so they are open to the public. Information about their next meeting and how to join is available as well. And next, we'll talk about dosing guidelines. So as previously mentioned, dosing guidelines include both the dosage form and the dosing amount. And the RMP, so the QMP or the LMP, can decide whether or not to include dosing guidelines in their recommendation. If they choose not to include dosing guidelines, then the pharmacy medical provider will work with the patient and look at all the information provided in the RMP's medical cannabis recommendation to determine what is going to be best. This table shows the list of legal dosage forms in Utah. And so there are often questions about other dosage forms or why a dosage form may not be found in a medical cannabis pharmacy. And the reason is because if it isn't on this list, then it isn't considered legal use for medical cannabis in Utah. There are several routes of administration, including oral administration that includes tablets, capsules, gummies, chews, gelatin cubes, lozenges, and liquid suspension. Um, Cannabis can be vaporized if it is unprocessed flower or bud, a wax, a resin, or a vape cartridge. Uh, Skin patches that are transdermal are available, as well as extracts and tinctures that are administered sublingually, and salves, balms, lotions, and creams that are administered topically are also allowed. One important thing to note is that smoking cannabis is illegal in Utah, but vaporizing cannabis, such as using like a vaping device and a vape cartridge, or there are like dry herb vaporizers for patients that purchase and utilize unprocessed flower. Those are legal. There are also dispensing and possession limitations. So in a 28-day period, a card holder can purchase no more than the smallest amount of the following options. An amount to provide 30 days of treatment based on the dosing guidelines and the medical cannabis recommendation, or 113 grams of weight or by weight of unprocessed flower, or 20 grams of composite THC in all other dosage types. And composite THC and all other dosage types is going to be the amount of THC in something like a vape cartridge, a tablet, a gummy, etc. And just for reference, the picture on the left is a bag with approximately 113 grams, or the state limit of unprocessed cannabis flower. And so you can see with the pen next to it, that is a decent amount of medical cannabis that a patient can purchase if they're allowed the state limit. And now we'll talk about medical cannabis pharmacies and some of their rules and regulations. So medical cannabis pharmacies must be equipped with a security system. Their outside signage is limited to a green cross and the pharmacy name, logo, and operating hours. All employees must be registered with DHHS and pass federal criminal background checks. As we discussed, they must have a licensed pharmacy medical provider, or PMP, on site during business hours, and on-site cannabis use is not allowed. They may only sell cannabis products, medical cannabis devices, and/or medical cannabis education materials. They cannot advertise specific products or dosage types to the public. And so that's when you're driving down the freeway and you see a billboard for a medical cannabis pharmacy, generally they'll just include the name, the location, hours of operation, and sometimes they'll include whether or not the medical cannabis pharmacy provides home delivery services. But you'll never see them say, hey, we sell this brand or this type of dosage form here. However, if a patient signs up for targeted marketing, such as an email list or text messages from the medical cannabis pharmacy, then they can receive direct individual advertising about specific products or sales. However, that information isn't allowed to be provided to the public. Pharmacies cannot offer samples, and they must follow product labeling requirements. We have 14 medical cannabis pharmacies with brick and mortar locations throughout the state. And we are very excited that a 15th medical cannabis pharmacy should be opening later this year in Price. So we are very excited to be improving access to a medical cannabis pharmacy in a rural area where there aren't other medical cannabis pharmacies available. As you can see, when you look at the locations, we do have medical cannabis pharmacies available throughout the state, from Logan to St. George. Salt Lake County and Utah County definitely have the most. But for patients who live in an area where there isn't a brick and mortar medical cannabis pharmacy, or if they have a condition where they aren't able to like drive, for example, or it's very difficult for them to leave their house and go to a brick and mortar pharmacy, um, there are several medical cannabis companies that offer home delivery services. And so on our website, there is a pharmacy directory, and that includes information about which pharmacy companies offer home delivery and which counties they offer home delivery to. That is everything I have for this presentation. Thank you so much for your time. If you have any questions, you can contact me directly. I believe UAFP will provide my contact information. Additionally, you can also email medicalcannabis@utah.gov or call our customer service line to get assistance and have questions answered. And I would also encourage you to look at our website. We have a lot of different resources on there for each different medical provider type. So resources and frequently asked questions for both QMPs and LMPs. We also have education materials if that would be helpful for you to provide to patients. We have a law fact sheet with more information about Utah's medical cannabis law and providing or recommending medical cannabis in Utah. And then we also have our monthly newsletter. So that goes out every month. And we highlight updates to the program for patients, providers, and industry. We have information about data about medical cannabis and information about upcoming public meetings. If you have any questions, please do not hesitate to reach out. And thank you again for your time.